Got it.
That took a second or two. Whoopsie daisy. Ow! I hit my elbow.
John, what's up, man? How are you?
Say, what's up?
Hey, can you hear me all right?
Yeah, I can hear you.
All right.
I know my stand. I don't know. Have it against boxes. I don't know.
Yeah, I'm still in my office here. So what I can do is actually, after we finish up, I can give a little demo for people that are watching, especially some of the PTs and chiros or OTs that want to see some of the equipment we use.
Yeah, that would be
I can do like a quick little kind of show some of the tools we use to help people get better. Sweet. So thank you guys for joining too.
During Thanksgiving?
I work till Wednesday. I work half a day Wednesday, and then it's family time.
There you go. Yes.
Yeah, my wife will be excited.
I'll tell everybody about last Thanksgiving this year. Oh my gosh, last Thanksgiving this time last year, we had no choice but to have Thanksgiving at our house because we didn't know if John would be able to get out of his hospital bed. This year, there's no doubt we are actually going to my parents' house and we are enjoying some food. What are we going to eat? What do you want to eat? What is your favorite?
Pizza.
Well, yes, that's what I'm doing. What else do you like? Turkey, yes. Pie. Ew, don't tell Daigle. Anyway.
Gluten-free pie.
Yeah, I don't know about that this year, but we'll try. I'm not cooking, so that's a good thing.
Heck yeah.
Anyway.
I'm glad. It's exciting. So, Lauren, that's what the main stuff for this, to let people know that, our goal in doing all this stuff is to educate people so that a way people can see that there is other options.
Right.
There's other types of doctors out there that people typically don't really know the qualifications or even really what some of these people do. And, what we do is something very totally different, especially, we look at more from a holistic approach, making sure that, people have good, clean diets, people have the proper lab work, people are doing more specific exercises. And when you start looking at stuff like that, you typically get really cool, outcomes that are a little bit different. And I tell all my patients that, if you're going to do something different, you're typically going to get a different outcome. And if you're doing the same repetitive, stuff and you're not getting any improvements, well, you need to find something different to be able to get to a specific goal. Right. So one of the things that, kind of starting like, what's the process look like and what do we do with John? And again, we mentioned this last time, we'll talk more in December 4th about this is that I think that, in my opinion, following a brain injury, the brain's inflamed. And what you have to do is you have to try to make sure that you don't create any additional stress on the brain. And that could be something, for example, like certain foods. So, have patients that are, they're tube fed. Certain patients can't, they can't eat, so they have to blend their food up, eating through a straw. But you really need to make sure that the foods that you're eating, that you don't have any type of sensitivity to that, meaning that your body doesn't respond in any negative way, meaning that you don't produce any more inflammation. Because a TBI, you're going to have inflammation, you're going to have swelling, you're going to have typically digestive issues. And so one of the things with John, what we did is we ran a food sensitivity panel and found that he was eating certain foods, for example, like even blueberries, something that was really good. Meats. Was any sense of any kind of meats at all, Laura? I don't recall. Chicken. And so these are good, healthy foods for most of us, but this is why you can't look at every brain injury as like a cookie cutter approach. It's right. Every single brain injury is completely specific. It's all, they have to have something tailored to that individual. And literally just altering someone's diet. I mean, we watched John's face, who was really swollen up. And again, even his abdomen was really distended. It was really hard. Yes. And just changing his diet. I mean, I want to say it was maybe within the first month. I don't exactly remember, but I know that there was quite a bit of weight loss.
Yes. Yeah. I totally agree with you. I think that people really just need to know that, it's all just plays part, everything that goes into the body, and that also, the medications and all that stuff. Let's talk about the spasticity, like John's spasticity in his left arm. When you first came, there was no movement in the left arm, right? And he was posturing when he slept at night. And you know, every time I find that we stretch it or work it, it just gets tighter, right? And so when you came along, you know, you were like, well, we need to hit the right side of the brain and really focus on that connection rather than just looking at the arm. Maybe you can explain a little bit about that. And then also at this time when you first came along, we were still on a lot of different medications that were supposedly helping that side, which weren't. But to find out now, we're a year later, we're off all those medications, and now he's moving his left arm, as you guys could see in the video of him crawling today.
Yeah, well, it goes back to this. Okay, first of all, what's going on in the body, and you know, again, a lot of times the medications do help out following injury to help when you're trying to figure out what's going on. But deep down, underlying is there any type of nutritional deficiency? So when you have a brain injury, people typically don't absorb stuff, and then we don't typically eat the right foods. So then you get these nutrient deficiencies, and no one really checks those things.
Right.
And in my opinion, that's some of the underlying issues that, you know, you could be having issues with your liver, and it's because you don't have enough of glutathione, which is a thing that you detoxify. So maybe you can't clear inflammation, and then inflammation is getting back into the blood, and it's making its way back to the brain. And if you're trying to build nerve function up, you know, and you don't have, you can't detoxify, you can't flush toxins out, then you're not going to build a lot of really good, it's called neuroplasticity.
Right.
Another thing when I look at tone is, you know, I have a lot of patients that'll have different surgical procedures to help with alleviating tone, or they'll get injections. But for me, it's like, okay, well, there's an area in the brain, it's called the cerebellum. And the cerebellum deals with movement, it deals with coordination, deals with calibration of smooth movements, help regulate muscle tone. And what I like to do is I like to do complex movements. I like to do big figure eights. I'll get a patient that'll come and see me, and they're like flex, like one arm like this and their elbows like stuck out like this. And what I do is I want to reverse that. So I'll take this arm that's flexed and I'll extend this one, and I'll actually work on doing the opposite. And we'll take a reflex hammer and actually hit like the triceps and go down the arm to work on trying to get the flexed arm extended. Or you can take the flexed arm and then you can put some vibration, light vibration, and you can start doing slow figure eights. You could even go down to the fingers if you have a hand contractor and start working on trying to do figure eights. And so what you do is you do a coordinated movement. And again, the better that someone has better coordination of a muscle group in an area, you're going to start having better control. Okay, so when you have a brain injury and the brain, you know, you have like, you know, a lot of frontal injuries or even a brainstem issue and some vestibular issues, you're going to see a lot of tone. And my opinion is that if you really work on trying to really stimulate the cerebellum, that you can help with alleviating the flex tone, or, you know, even the posturing. And then it goes back to checking for primitive reflexes, which are huge. And, you know, back whenever I was earlier getting into practice, you know, I learned from some really great, incredible doctors. And I was taught to, you know, start looking in the eyes, you know, making sure that, you know, the eyes can move and you can fixate on something. You can really focus, that your eyes can like track, your eyes can jump. And I ended up started working with Dr. Robert Melillo, who again now is a guy that I lecture with and teach with him. And he told me, say, Kyle, look, you're doing things wrong. You need to really look for primitive reflexes, or what's called frontal release signs. And that's been a game changer. And I hope everyone listening to me will actually like listen to this, because this is huge, is that when you look at a brain injury, you have to look at it from a developmental standpoint, meaning that if someone was in a coma and they come out of a coma, well, their brain basically reset. And what happens is if you look at their face, their facial tone is going to be off. You can even see if they've been in a coma for a long period of time that even their teeth can get altered. And the question is, well, why? And when you have a brainstem injury and you have the brainstem that has all these nerves that innervate the face, they innervate the tongue, they innervate the throat, you'll start seeing that patients who have brain injury, especially the longer they're not working and stimulating, their face can get altered, or their teeth can get kind of deviated or altered. So look for primitive reflexes. You know, I've seen people that are having issues with aspirating, and, you know, you check their rooting reflex and they still have one. And again, what you do is you have to work on getting rid of that reflex. And how do you do it? You stimulate it. And the more that you stimulate it, you're increasing blood flow to that area, and then you start improving the function of it. And I think that, in my opinion, that primitive reflexes are huge, and they're so missed, and they're so not, that we don't use that in rehabilitation. But that right there is, my opinion, a huge game changer, just like doing nutrition, food sensitivities and running nutrient panels, but primitive reflexes. So, I see this all the time. Like, even you guys, you posted a picture about John crawling. And it's like, look, Laura, I know we want to get John to walk and start moving, but we got to get him on the ground, because you got to crawl before you walk. Yeah, I know, just crawl. Like, you guys got to start crawling. Think about a baby, the development. First of all, they start crawling, and then they start crawling looking up. As they look up, they're building their posture muscles to be able to sit and stand upright. And you got to think about that. And when you have a brain injury, get on the ground, start crawling. And if someone can't crawl, then what you can do, it takes a team. I have a phenomenal team. I have a bunch of really impressive, doctors, and I also have really great therapists that work with me, and even some of my techs. And we'll get on the ground. We'll have 5 of us, and we're moving people. We'll do like the lizard, where we'll literally get them on their stomach, and we'll start, bending the elbow to the knee, and we'll go back and forth. I get excited doing this stuff.
He did snow angels today.
Yes, and snow angels.
Legs.
Laying on your back doing snow angels, and all those things. So you cross the midline and shoot up, making like a starfish.
He did that today.
John, you did a starfish?
He did starfishes.
What? Well, and so people that are listening to this stuff too, you can see that if you ever walk up to someone who has a brain injury and they're focused on something, and you walk up kind of side, you'll see them kind of startle, and they'll freak out and get kind of really upset sometimes if they can't regulate. And it's called a moral response. Or startle reflex. And that reflex right there, you mentioned the starfish, is a great exercise that you can do to try to help out with getting rid of that. And so a lot of times you'll see these patients that might have a lot of anger issues or a lot of really bad anxiety, and they're just constantly nervous, and then their heart rate's above 130, 140, and their brain's stressed out. Can you imagine their digestive system? They're not going to digest stuff.
Right.
And they're going to be super inflamed, and they're going to be constipated, and that's going to create a bacterial overgrowth in their intestines. And now they're going to start getting recurrent urinary tract infections, or upper respiratory infections, or even toe fungus on their foot, or even staph infections. And it's because they're not digesting food, and then it's building a bacterial overgrowth, and then it's getting back into the blood, and then it's going wherever it wants to go. I love this stuff.
I know. There was something I was going to say about let's go back to stimulating the reflexes or stimulating certain things. Speak about there's ways to kind of gear overstimulating them. So don't keep doing the same thing. I'm not one of you guys. Learning the signs of, okay, stop, take a rest, do it again. There's also there needs to be a rest into work.
Right here. Perfect thing. Something, if you're a caregiver, something super cheap that you can buy. You buy a pulse ox. And what you do is you just put a pulse ox, this is caregivers, this is PTs, this is OTs, this is chiros, whoever. If you're working with a brain injury, use a pulse ox. Put it on their finger, get a good baseline reading. You might see that it might be 95% oxygen. Their heart rate could be 77, 76, maybe even 58, whatever. But what you do is you look to see if the oxygen level drops 2 percentage points and the heart rate goes up 10 beats, that patient has met what's called metabolic fatigue. You need to just relax, chill out, don't do anymore, don't push them anymore. And a lot of times what happens is people start doing rehab, and again, their brain's so fragile. You start doing all these stimulations, and then you over-fatigue the system, and then you keep pushing people more and more and more. And then what happens is you're going to start seeing their tone starts to increase.
Right.
And you're really not going to get really any great rehab that day. So you can't push people. So that's something great to do, is just, and I love these things. I always use a pulse ox whenever I'm working with people.
I think that's important to know, because, in our experiences, sometimes it's in rehab, people want to just keep going. And it does, I think everyone following's Laura, does John ever rest? But honestly, it's kind of the thing, we do little bits here and there. And it's really important that we don't, I think one of the big things that you've taught me is it's not about how much, but it's about the consistency and doing it very frequently.
Yeah, no, and again, that's some, and then there's like really cool things like this little thing called a ResiMax.
Oh, I love that thing.
Yeah, this thing's awesome. You can turn this thing on and you can stimulate the face if you want to maybe like help get rid of like a rooting reflex, or, I've seen, speech therapists that have used this stuff to help out with people to try and, yeah, you stimulate the tongue. And it's like, if people can't speak, well, then activate the muscles. And then you
really
can,
good.
And then you can even use these things too if you have like, you have a patient who has like a hand contractor, or even like John, when John's trying to crawl, you put this thing on and it's vibrating. And what vibration does is it activates the brain, so the brain becomes more aware. And so if I'm going to work on crawling and my brain's trying to learn about my spatial orientation, if my brain sees my arms and stuff moving in certain directions, I'm starting to build up better awareness of my surroundings. So then now I'm going to improve my balance and my coordination. Yeah,
I really like this. I think one thing that we're kind of getting at with people is the face is so important, especially with the brain injury. And, it's very common to see like a side that's not working as much. But what I want to say, and I think you would say as well, is there's hope for those. Like, don't think that just because you have a weak side, it's a weak side forever. I think I have a weak side too. But with so much, don't even get started. There's so much different stimulation you can do. Like, John for himself, when you came, he couldn't move that left side of his face. And now it's like, it's incredible. So I guess what I think people need to realize is, there's so many different stimulations on the face. I think I posted a story feed today of John getting acupuncture. And,
yes.
And it was like total face. That is just, first off, the first time he got acupuncture 2 years ago, or like first in rehab, we pulled them all out. So we had to wait a while. But I just feel like the more and more we do on his face, it just helps everything else.
Hey, Laura, while people are listening to, tell them about the acupuncture point or the acupressure point in the ear.
Yeah. So it's the shin min. You got me on this, and I think he's worn it every day since you've come. Granted, I take them off and I clean them, you guys. But we put actually an ear seed or a seed. What are they called? Acu-seeds or whatever?
Yeah, acupressure beads, acu-seeds.
And we put them in his ears. And so this stimulates to the brain. And
it helps. So anybody who's listening to here, and it's really cool, we recommend, we tell people that, you can stimulate this point shin min. You can just like, you can put like a laser on the ear. You can touch the point. You can get like an acupressure bead on there. But like for example, like if you're trying to help get someone's hand to move or trying to loosen a contraction, you can put, the acupressure bead, or you can stimulate that point shin min in the ear, and you can vibrate the area. And it's really cool because, I've seen patients literally who have like, they had a stroke or they had a spinal cord injury, whether it's their foot, their hand, and they don't have any movement. And then we just stimulate that point and you vibrate it. And then they literally start getting fasciculate, or they start, being able to like activate their hand or their toe. And it's like, wow, literally I just touched one point. And this is where people, I think for brain injuries is like, the more diverse your education is, the more that you really know. And everything has its place. Everything. Right. Acupuncture, acupressure, laser therapy, nutrition, functional medicine, functional neurology, chiropractic, PT, OT, massage, music therapy. Everybody has, they're really great at what they do. And it's just the more that you can integrate stuff.
Yes.
And that's where we're getting great results, is when it's not that one person's better than the other. It's we work as a team. And that's what we did with John. John's got an incredible team. He's got a bunch of phenomenal doctors that I work with, the colleagues of mine, and they're all great at what they do. And, we all stay in our lanes. And it's, when I get to a point where I feel like I'm not good, for example, like, which is Dr. Siegler's going to talk about in mold, I refer out to something like that. And he's going to be super smart. You're going to love this guy. He's incredible. Dr. Malilo, he's phenomenal at primitive reflexes. He's by far the guy, he's my mentor. And then, he's going to talk about numerous things like primitive reflexes, core, how to stimulate, the right side of the brain, the left brain. And then you have guys like Dr. Ryan Cedermark out of Atlanta, who's a nurse practitioner who knows a lot about how to integrate medicine and nutrition and then functional neurology. And they have a guy named Brandon Brock out of Dallas, Texas. And then we have Dr. Brandon Crawford, who is phenomenal with lasers and shed light. Yeah, and it's just, again, it's all about like, it's a team, and that's what happens with a brain injury is that you just need a team effort. So yeah, I mean, so I guess I'll just kind of give, I have probably, I have a lot of different kind of things, but the one thing I want to stress to you guys is one, making sure that you work with some sort of doctor that is going to check for primitive reflexes or even therapists, and that they know how to actually get rid of them. That's a huge number one thing. Number two, making sure that you have a functional nutritionist, or you have a functional medicine practitioner, or you have like a nutritionist or a health coach, someone that's going to teach you about food sensitivities, nutrient deficiencies. And again, you have to build a foundation. And that's why John, people want to know, he's recovering so well, is because we've built a great foundation. We did all these exercises and stuff and nutrition. And then what happened is you're seeing him like blossom. And it's really cool to watch, because in a typical model that you don't really do this kind of stuff, you kind of really don't really get a lot of progress. It's just kind of incrementally, you see these little bitty kind of small steps. And then you guys are getting to witness something that's like huge. And then, in our world, when we do this kind of stuff, these are typical gains that we see. This isn't something shocking to me to see John, getting this amount of, progress. It's because when you find things that are missing, you find, nutrient issues, you find food, you find mold, you find primitive reflexes, you find muscle imbalances, and then visual issues, posture issues, and you work on capitalizing on that, you're going to get better improvements. It's like a sniper. If I see a target and I know what a target is and I zoom in and I shoot it, I'm going to typically hit the target. And that's what's really cool about John's case, is that, we're really looking at it from, all these different angles.
Right. Which where are we at? We're coming up on 3 years in this next year. And I mean, he's making so many gains every single day. It's just.
Yeah, absolutely. John, you look so good, dude. You're so good. I'm ready to see you guys back down here. And I'm gonna get you some good gumbo and some boudin.
Some food, some fruit. He loves some food.
Yeah, we're getting some Louisiana food.
So communication. What is one of our biggest things? But last week I made something and I tasted it and I was like, it's not that great. I gave it to him and I saw him take a few bites and he's like, I said, John, is it okay? And he's like, I was like, you want something else? I was like, yes, like that was a positive. I mean, granted, he didn't like what I made him, but I love that he communicated it to me.
Absolutely. Hey, Laura, we have a few minutes and then you guys are going to get on the thing with Siegler. So one of the things I want to just talk about, so just if you can just real quick, let people know about like the mood and stuff, on how when we started doing, I helped guide you guys and coach you guys about how to do like more right brain stimulation, like what happened, how did that start helping out with like his mood?
Well, when you first came, it was pretty tough. He was in the bed for 23 hours a day. We'd get him up to feed him. He was back in the bed. It was dark, right? When you came, John, you just really explained to me what's going on in the brain. Like, it was so funny when you came, you're like, right brain, this is this. I'm like, oh my gosh, you gotta like speak English. But really what you focused on, you're like, okay, he's overdriven. And that's also the Navy SEAL in him, in this left side. And you're like, it's all his left brain doing everything. And so you started teaching me like little things I could start doing, just like the colors and just, different music to play. For the longest time I played 528. I think I went months like on repeat 528. And then also hitting that point. And those were little simple things. But John's mood just kind of like, it got less and less. We went through peaks and valleys and you do that. But then, now his mood, we don't have any of the agitation anymore.
Sweet. Yeah. Hey, Laura, so let's do this. For those of you guys watching, I want to give you kind of a quick little, as much information as I possibly can, but, I don't know if anyone out there uses essential oils. There's a couple of oils I like to use. One, eucalyptus and peppermint. And what we typically do is you can put that like on the right collar of the shirt, because that can actually stimulate the right side of the brain. And then people who have like a left brain issue, So a lot of times people have like issues with speech, or they have issues with like fine motor skills, or you'll see, you can use like lavender on the left side. And then even music's really cool too. So if I have like a right brain injury, then I might listen to some sort of like melodic, kind of like acoustic guitar, or like maybe some classical music or something, and I can put it in the left ear. So the left ear stimulates the right side of the brain. Or if I have like a left brain injury, then I can listen to music in the right ear. And then, if you can't wear headphones and stuff like that, you can just take like your iPad, or you can take like a Bluetooth speaker and play music, from the right side. Or I've even seen people where you can take, like, if someone's on a ventilator and they can actually like move the ventilator to where they're hearing sound from that one side. There's people who use music therapy where they play like guitars and stuff like that on one side versus the other. And I'm trying to think of anything. Oh, and how about this?
To the patient, you think about it, even in the hospitals and stuff, and I was very much about this, even coming in, how John was set up in each place, how you come in and how you talk to them. You got to think about it for a brain injury. If they're always looking that way, you're building that repetitive motion as their brain's healing. So it's also good to go to, the different sides of the bed to do IVs, doing whatever, try to keep that, depending on what that body needs. But just be cautious of those kind of like little details, like huge.
Absolutely.
Benefit.
Two things that I'll get out. So one, color lenses. You can get off Amazon. I mentioned some stuff. Red lenses activate the left side of the brain. There's blue lenses, activate the right side of the brain. And then I'll give you a quick little, so two things. One, we do have Dr. Malila. We have a course January 18th and 19th in Atlanta, Georgia at Life University, where we're teaching protocols and teaching people how to assess primitive reflexes and how to get rid of them. And then we do have, and some of you guys are out there listening on Brain Chat, Dr. Brock, Dr. Cedarmark, and myself, and Dr. Crawford, we went over some of John's case, which is pretty cool. We talked about some of the protocols, and I guess I'm going to get off here and let you guys get on the phone with Dr. Siegler.
And then you and I are getting back on December 4th, and we'll tell everybody about that. But we're going to do it again so we can go longer.
Yes. So awesome. So guys that listen, I hope you share this stuff. The whole purpose of doing this stuff is just to educate you people. And again, I want to say, first of all, Laura, John, and myself, we're very grateful. I'm very grateful to be part of this. And it's really cool because it's a really cool, to some of you guys that are listening, there's a lot of faith. There's a lot of stuff God's put us all together. And it's really cool because we're getting to see lots of people from all over the world that are benefiting from us sharing this story. And, I'm excited. And if you follow my page, I'm constantly trying to just give you guys research. And the whole goal is just to try to, we're all in this world fighting a battle. And we just want to make sure that everyone at least tries to, we never give up. We keep going forward. And so I'm very grateful that,
we're grateful for
you guys, and I love you. And John, you
Same.
have yourself a great evening, and hey, go Tigers.
Oh, snap. No, All right, guys, we'll talk to you later.
All right, bye guys.
Bye.